Today we are going to discuss the prescription writing. Now for that we should know what is mean by prescription. Prescription is a word which is derived from pre means before and script means writing. Now by definition it's a physician's written order by a registered medical practitioner who can write prescription. Registered medical practitioner to whom? To the pharmacist. For what? For preparing and dispensing the medicine. For preparing and dispensing the medicine for the benefit of recipient. Now what are the parts of prescription? There are four main parts: superscription, inscription, subscription and transcription, and lastly there is the signature of physician or doctor. So these are the main parts of prescription. This prescription is a legal document which carries medico legal implications. So while writing prescriptions, you have to be very careful because it carries medico legal implications. In the past, in the past, prescription contain instruction to the pharmacist. For what? For mixing or compounding the pharmaceutical products. In the mortar and pestle we have seen this is the mortar and there is one pestle, right? So in that we have some active ingredients, adjuvants, correctives and vehicles. But nowadays most prescriptions are pre-compounded. In the modern times, most prescriptions are pre-compounded. Most pharmaceutical products are manufactured. They are already manufactured. No need to mix and compound and then dispense. Now, what is mean by extemporaneous prescriptions? The reserved for compound prescriptions. Extemporaneous prescriptions, they are reserved for compound prescriptions that require pharmacists to mix and compound the medication in the pharmacy. We call them extemporaneous prescription, right? I don't think so nowadays uses. Mostly in the Ayurveda we use this extemporaneous prescriptions. Now superscription, the first part of prescription, it comprises the details of the doctor. In that there is a name, degree and designation, date, registration number, phone number or contact number. Then in that superscription, details of the patient also: name, age, sex, address, weight, symbol rx. Symbol rx means take do or आप लीजिए in Hindi. So all these things comprises in the superscription: details of the doctor, details of the patient and the symbol rx. Now inscription, it's a body of prescription. It's a body of prescription. It comprises of the drug prescribed to the patient. It contains all the drug. It contains all the drugs, names of the drug, its dosage form, whether it is in a tablet form, whether it is a capsule form, ointment, injection, and strength, whether it is 50 milligram, 100 milligram, 200 milligram, 500 milligram, whatever. When multiple drug therapy is given, so first, when multiple drug therapy is given, then in that case you have to write the principal drug first, basis. It's a primary or principal or active drug for a particular clinical condition and should be written first. If there is a patient of malaria, so what is the first drug that you have to write? Chloroquine. That is the first drug or basic drug or basis. It's a primary or principal or active drug for a particular clinical condition and that should be written first. Chloroquine in malaria, right? For example, tuberculosis, isoniazid in tuberculosis. So that is the basis. Now adjuvant. This adjuvant is a drug that enhances or supplement the action of basic drug or for any other associated symptom. For example, in the malaria there is a fever. So what we give? Paracetamol for fever in malaria. So this paracetamol is a adjuvant drug. Paracetamol is a adjuvant drug. What we have uh, used adjuvant to reduce the body temperature or to reduce the fever, we use paracetamol. Then third one is the corrective. It is a drug to overcome any undesirable effects of the base or adjuvant. To correct the side effects, in simple words, or any undesirable effects, we use domperidone, anti-emetic effect. Domperidone, anti-emetic drug. Because of chloroquine, there is a nausea, there is vomiting. So to correct that, we use the corrective. For example, anti-emetic nowadays, anti-emetic plus what we use? We use the pantoprazole, rabeprazole, proton pump inhibitors, emulsifying or suspending agent to make a suspension or emulsion, not in a pre-compounded medicine, but for a extemporaneous prescription. Vehicle, excipient or base, the medium in which active ingredients are distributed. Vehicle, excipient or base, the medium in which active ingredients are distributed. So this is what we have to maintain the sequence. First basis, then adjuvant, then corrective, then emulsifying or suspending agent, and then vehicle, excipient or base. Now, if more than one dosage form given by different routes, if more than one dosage form given by different route, means first you have to write the injections. If you are giving any injection, for example, injection gentamicin, injection diclofenac, injection paracetamol, injection ranitidine. So first you have to write the injection. Then you have to give the oral preparations. For example, capsule amoxicillin. Then write capsule amoxicillin first. Then write tablet paracetamol. Then cough syrup, liquids, and finally the topical preparations. For example, if you are giving some gel, ointments, lotion. So this is what is the sequence that you have to maintain while writing more than one dosage form. First, you have to write the injections, then the oral preparation. In the oral preparation, first capsule, then tablet, then liquids, and then topical preparations. And all in these cases, you have to prefer the generic names over the brand names. No one does, but you have to follow this. Now, subscription. This subscription is the instruction to the pharmacist regarding drug formulation. How to means actually in the pre-compounded there are no such instructions. Only thing that we have to send such 10 tablets, send such 5 capsules. That is the instruction to the pharmacist. Subscription means instruction to the pharmacist regarding drug formulation. How many drugs or how means whatever the instructions, send such 10 tablets or something like that. But in pre-compounded, but in the extemporaneous prescriptions, there is a particular role of a pharmacist. Means he has to mix and compound and then dispense. So there is a so many instructions in the subscription for the in that extemporaneous prescription. So what is subscription? It's a instruction to the pharmacist regarding drug formulation. Transcription is a direction to the patient to take the drug, whether it is taken twice OD, BD, thrice a day, before meal, after meals, for how many days, everything. Then signature of a doctor. At the end of a prescription, doctor must write name with signature and thus make it a medico legal document. And there is a stamp also. At the end of prescription, doctor must write the name with signature and there is a stamp. And that's why it makes a medico legal document. Now that we all know, this is the summary. Parts of prescription: superscription, inscription, subscription, transcription, and lastly signature of the clinician. Right? In the superscription, what we have to write? We have to details of the doctor and details of the patient, details of the doctor, details of the patient, and the symbol RX in the superscription. In the inscription, the details of the drug, means what is the formulation, what name of the drug, or you have to write the generic name, you have to write the dosage form, you have to write the strength of the drug. Then in the subscription, direction to the pharmacist. In the transcription, direction to the patient. So all these are the parts of prescription that you have to follow. Now, what are the general instruction for the prescriptions? It should be clear, concise, complete, accurate, and legible. That prescription should be clear, concise, complete, accurate, and legible. It should be written by indelible ink pen, not by pencil. It should be written by indelible, which cannot be wiped out. Indication for all prescription. Indications. What is your probable diagnosis? You have to write the indication, what you have given for malaria, for tuberculosis, for HIV, or anything, for dysentery, anything. Never pre-sign a blank prescriptions because it carries a medico-legal implications. So never pre-sign a blank prescription. You have to write the prescription on a proper letterhead in which the details of the doctor is written particularly on the top of the prescription, proper letterheaded. It should be written by a generic name. This no one does nowadays for the promoting various brand names, but you have to write the names of the drug in the generic form. Should be in the capital letters. All the names of the drug that you are writing, it should be in the capital letters. Only one drug in one line. Only one drug in one line. Then unit should be accurate and clear, whether it is milligram, whether it is microgram, whether it is gram. You have to write the units accurate and clear. Then abbreviations regarding the time of administration. Abbreviations that we use for the pharmacist, not for the patients actually. For example, we use the AC, PC, AM, PM. Means AC means before meal, after meal, before noon, afternoon, alternate day, each morning, daily once, each night, at bedtime, HS, when required, if necessary in emergency, SOS. All these are the abbreviations that we use, or BD, TID, STAT, QID, twice a day, thrice a day. These are the abbreviations that we use in the prescriptions, right? IM, IV, intradermal, subcutaneous. So you have to be very particular while writing abbreviations, and that abbreviation should be clearly explained to the pharmacist as well as to the patient. Now, this is what is the prescription format, ideal prescription format. An ideal prescription for a hypertensive patient who has a history of bronchial asthma. So, superscription. In the superscription, what they have written? Details of the doctor. What they have written? Details of the doctor. Then details of the patient. And then the symbol RX. Three things are there. Details of doctor, details of patient, and the symbol RX. Right? Then inscription, the details of the drug. For example, details of the drug means there is a dosage form, whether it is tablet, capsule, injection, whatever. Then the name of the drug. The only thing that is missing over here, that the name of the drug is not written in the capital. That is the thing that is missing. Amlodipine 10 milligram. This is the thing which is missed over here, which is not written in the capital. Then what? Then in a subscription, send such 30 tablets. This is the instruction to the pharmacist. Send such 30 tablet. One tab to be taken daily at bedtime for 30 days. This is the transcription, means direction to the patient. You have to take one tablet taken daily at a bedtime for 30 days, or you can take this amlodipine in the morning, after meal, or after breakfast, whatever the instructions that you have to give. To follow up After 30 days for the reevaluation of the blood pressure and review of the tolerability, you can ask for a follow-up. Then lastly, what is important, the signature and the registration number, name of the doctor, signature, registration number, and then stamp. All these things are very important while writing prescription format, and hence I said that prescription carries medico-legal implications. Prescription carries medico-legal implications. So that's all for today for the prescription writing.